This conference will now be recorded.
All right, good afternoon, everyone, and welcome to our second Friday noon webinars. Tanya and I joke, we promise to have a better name for these next year, something more fun. But thank you all for joining. These calls are really just intended to be a way for us to share what's happening at the Capitol around oral health with all of you, and also provide a bit of an educational aspect for those who might not be as familiar with the legislative session in Kansas and how things work. So we will go ahead and get started. So in the past 2 weeks, we've had a lot going on around budgets. We are getting the budgets figured out for 2019. And so or 2020, I apologize. And the ones that we're really focused on are Department for Children and Families, Department of Aging and Disability Services, and Department of Health and Environment. We testified in the House and Senate for DCF budget, and our interest in DCF is trying to get them to have conversations with us around submitting a waiver so that we can use TANF or SNAP for a toothbrush or a toothpaste, because right now, we're hearing stories that sometimes families have to share one toothbrush, or maybe they don't have a toothbrush at all. And we think that this would be a simple avenue. They're already getting some of these benefits. Why not allow them to use that money for a toothbrush or a toothpaste, whatever they need? So we testified verbally for both of those, and had very good feedback from the Senate. The chairwoman of the Senate Ways and Means Subcommittee on Social Services followed up with us after and had her chief of staff get involved and had him do some further research. So we were really excited by that. Going to KDADS and KDHE, we will be testifying in both of those budget hearings over the next couple weeks. And in those committees, we're really trying to ask for them to look at comprehensive adult dental benefits and increasing the reimbursement rate for dentists enrolled in CanCare as they build those budgets. So that's kind of what the hot topic is right now for us in Kansas. These are hearings that we have heard over the last 2 weeks, and then also the upcoming hearings. So in the past 2 weeks, we listened to the House Rural Revitalization Committee, and they had 3 days of hearings that were focused on healthcare and Kansas rural communities. And the Kansas Dental Association testified at one of those hearings and spoke to the need for increased reimbursement rates so that we can have more dentists enrolled in CanCare, especially out in our rural communities. It was very well received in that committee, and we had lots of questions from the committee members. And one of our favorite questions was, one of them asked, why is oral health excluded from overall health? And we were like, yes, you get it. This is exactly what everyone should think. So we were really excited to hear that. And then the CanCare Oversight Committee is the committee that oversees our Medicaid program. And we testified at that committee hearing on Friday the 15th. And we introduced ourselves because it's a new committee, or has new faces on the committee, and introduced ourselves and reminded them of the recommendations that the previous CanCare Oversight Committee made in November. And those 3 recommendations were comprehensive adult dental benefits, increasing the reimbursement rate for dentists, and reintroducing the dental therapist bill. They were also pretty receptive at that committee hearing as well. And one of the senators, Senator Boyer, asked us to follow up with her on reimbursement rates. So that is something that we are working on right now. In the next 2 weeks, next week, the House and Senate will be on the floor for most of the week because we have turnaround day, which we will talk about later. And then the following week, we will have the KDHE budget hearings and kind of wrap up some of those budget hearings. On Monday is the KDAD, or Department of Aging and Disability Services, budget hearing, where we'll submit written testimony. So I'm going to hand it over to Tanya to kind of talk about the budget process in Kansas, just so that it's kind of confusing, and we just want to make sure everyone kind of understands how it works.
Thanks, Christy. We really, after our first call like this, we got some feedback that it would be helpful to not only talk about what's happening with the legislature and with advocacy, but also talk about, do a little bit of education about the legislative process. So we're going to try at each of these calls to do a little bit of a deeper dive into one aspect of the legislative process. So today we're picking the budget process because we're really right in the thick of things. So I'm going to describe this, I'm calling this part one of episode, and we will continue the part two later on as we get a little further in the session. So really, I want to start with this. The state budget process, of course, has many, many steps. The process starts each fall when the cabinet agencies submit budgets to the governor for the next year. The governor then reviews all the budgets that are submitted by those agencies, uses them, and puts together a big governor's budget recommendation. In the legislature, everybody calls this the GBR, the governor's budget recommendation. Then the governor discusses the GBR at the State of the State address in January each year. The legislature receives a copy of it, of her budget, and then they get to work. So in the House, the Budget Committee is known as the Appropriations Committee. In the Senate, it's known as the Ways and Means Committee. Each of these committees receives the GBR and then divides up the budget among its subcommittees. So today we're using the example of the budget for the Department of Children and Families, or DCF. As Christy described, we already have done some work with that budget, so that's why we're going to use that as our example. By February of each year, the subcommittees in both chambers are working on their agency budgets, so that's where we are. When the subcommittee schedules a hearing on an agency's budget, it begins with an overview by the legislative staff, and they describe the agency's scope and the responsibilities, and then share the GBR for that agency. Then the agency leadership gets the chance to describe their agency's goals and priorities, and then again discuss their own budget needs. Next, stakeholders like Oral Health Kansas and many, many others have the chance to testify about the budget. Some stakeholders ask for very specific appropriations for a very specific thing. Something that's very common in the Department of Aging and Disability Services is ask for an appropriation to eliminate the waiting list for home and community-based services waiver, for example. Other stakeholders ask that the agency make a particular issue a priority. So again, using this DCF example, we testified, as Chrissy said, in the House and Senate subcommittees, and asked them to explore the possibility, ask the agencies to explore the possibility of asking for a federal waiver to allow Kansas to use TANF money for families to purchase toothbrushes and toothpaste. There's just a lot of weight and accountability when the legislature tells an agency to work on something like this. So then, after the subcommittees hear from the agency and the stakeholders, they get to deliberate on the budget. They very rarely take the GBR exactly as presented, probably never. Sometimes they end up deciding to add money to a particular part of the budget. Other times they might take money out of the budget. They also really do frequently put notes in their budget reports that direct the agency to do something, such as explore a federal waiver. Then the subcommittee reports are sent to the Full Appropriations or the Ways and Means Committee, and then those larger committees decide whether they want to adopt all the budget changes and recommendations from the subcommittee. Once all the subcommittees on all the agencies are done, then the Appropriations Committee puts together their bill that has all their budget recommendation, and the Ways and Means Committee in the Senate puts together their bill with their budget recommendations. Then those bills are sent to the House and the Senate floor, so you can see that's where we are on the slide here. At this point, the budgets can be amended by members of the legislature just on the floor of the House and the Senate, and with any luck, after all of this, each chamber will have passed a budget by the time they adjourn for the brief recess we always have in April. And at this point, then we start that recess with two versions of the budget. The House has a version, the Senate has a version. So of course there is a lot more to the budget process. This is it's a lot to get here, but there's a lot more. And we'll continue that discussion when we get a little further along. We often say that the budget isn't over till it's over, and that's true. while the governor has made her recommendations and the subcommittees are now working on making their own recommendations, we won't really know what's in the next year's budget until the legislature adjourns, which hopefully will be in May. So that's kind of a high-level overview, but a whole lot of details, and I appreciate everybody's interest in the issue. Christy, I'll turn it back to you.
Thank you, Tanya. And I will just kind of pause here to make sure we can answer any questions that anyone has about this step in the budget process before we move forward. You can either type your question in the chat box, or your line should be, you can unmute your line, I guess. Okay, great. Well, we will move forward, and if you think of a question, there will be time at the end that we'll also pause for questions. So, okay, next we wanted to just touch on turnaround day. I had mentioned when we looked at the calendar that next week the House and Senate will be on the floor most of the day, and that is because they are trying to get any bills out of the chamber that they can. So turnaround day is on Thursday, February 28th, and this is when bills from non-exempt committees need to be passed by one chamber to be considered this session. And there are several exempt committees that can still introduce bills after this deadline, and those are there on the screen. And so this is an important time to make sure if you have a bill that it gets through either the House or Senate so that they can consider it for the remainder of this session. Otherwise, they'll have to wait until 2020 to consider it. So one example would be Senate Bill 11, which is the dental therapist bill. This was introduced in the Senate Public Health Committee, and it was introduced at the very start of session this year in January, and it has not had a hearing yet, and so it doesn't have one scheduled for next week yet either, and so odds are it's not going to leave committee in time for it to be passed through the Senate. There is one way that it could still be heard this session, so that would be, they call it touch. So if it touches any of the exempt committees that are listed on the screen, it can be turned back alive during this session. So say it leaves Senate Public Health even without a hearing and they refer it to Senate Ways and Means, that would be touching the exempt committee, and so there would be chance for it to be heard in the Senate even after turnaround day. So it's kind of confusing, but just because something isn't heard before turnaround day doesn't mean that it is completely dead. There is still a chance for it to touch one of these exempt committees and a chance for it to be heard again in 2020. So this is just a big deadline, though, upcoming. So does anyone have any questions about turnaround day? Or Tanya, do you have anything else you'd like to add?
I don't. I think you explained it well.
Wonderful. Okay, well, we will move on. I wanted to briefly mention that Oral Health Kansas is involved in the Medicaid Quality Improvement Learning Academy. This is organized by the American Dental Association, and it's an opportunity for partners in Kansas to come together to work on a part of the Medicaid dental program that we want to improve. So we are working with the Community Care Network of Kansas, which is our primary care association, formerly known as KMU, the Kansas Dental Association, the Kansas Department of Health and Environment, ourselves, and Sunflower Health Plan, which is one of our managed care organizations. The problem that we have chosen to work on is the need to increase access to dental care for children and adolescents with intellectual and development disabilities. Just from anecdotal data that we have heard, this population has difficulty finding access to dental care in our state. And so we are working with all of these partners and the American Dental Association to address those barriers and hopefully improve care over the next year. So we will be traveling to Chicago next week to work with all of our partners there, and also work with our coaches from the American Dental Association to kind of address some of those issues. And I just wanted to mention it because it's kind of policy related, and just another way that we're trying to improve our Medicaid program. I had mentioned this on our previous call, but for those who couldn't be on that call, I wanted to mention that you can listen live to committee hearings. So you can visit that link on there, and then, which is just the Kansas Legislature website. And in the upper right-hand corner, you hover over the audio video tab and select State House Live and Archive, and then it'll show all of the hearings that are happening that day, and you can listen to them. You can also go back and listen to previous hearings. So like this morning, I went back and listened to a hearing that was on Wednesday. So if you weren't able to be at that hearing, or you heard it was interesting, you can go back and listen to those on there as well. A great resource from our legislature. That is all I have today. I will open it up if anyone has any questions, or if there's anything that you would like to see us cover in 2 weeks. Anything that's on your mind, this is the time. So once again, you can put it in the chat box or take your phone off mute.
Christy, I guess I just wanted to add, this is Tanya, I just wanted to add that normally we'd like to kind of do an update on several different bills, and there's just not a lot of bills that we're tracking right now that are making a lot of movement. So the budget is kind of the main thing. We know that there's a lot of conversations, both in the daylight and kind of behind closed doors, about Medicaid expansion and whether that's a possibility this year, because as we know, the governor's very supportive of that, but the legislature is not as supportive as they were last year, possibly. So, that we'll kind of stay tuned and see where things go. Nothing really public yet at this point, but we know there's a lot of discussions. So I just wanted to highlight those two things because those are the other kind of big issues in the session so far.
Yes, I'm glad you mentioned that. Thank you. All right. Well, it doesn't look like we have any questions.
Christy, this is Peggy.
Yeah.
I just had one point of clarification. So given that we're at the turnaround and things are, going to be moving forward into final actions, does that mean that basically all the testimony opportunity is pretty much behind us now, or will there be testimony and hearing opportunities that need to be attended to from this point through the rest of the session, or does it become more floor action at this point?
That is a great question, Peggy. Tanya, I'm going to take a stab at this and then feel free to follow up. So let me go back to this slide, actually. That might be helpful. So there is still an opportunity for hearings when a bill would touch these committees. So for example, the dental therapist bill, if it was referred to Senate Ways and Means, they could refer it back to the Senate Public Health Committee, and there could still be a hearing on that. So there is still opportunity for hearings. They just all have to touch these exempt committees before they can go back.
And so,
Christy, and I will. The other piece of that is basically all the bills that started in the House need to be in the Senate. All the bills that started in the Senate need to be in the House. So then the process starts all over again. So there's going to be a lot of opportunity to testify in everything that came out of the House and went to the Senate and vice versa. And then, as I said, too, the budget discussions will be continuing. So I think basically through the month of March, there'll be lots of opportunities to be in front of committees talking about bills and budgets.
And for those of us that aren't able to actually be in the State House regularly, what is an easy way to find out when a hearing that you might be interested is going to be happening? Is there a simple place on the website that kind of information is updated every day, or?
Yeah, that's a great question. Oh, go ahead, Tanya.
I would say yes, there is. There on the website, on the legislature's website, it's kslegislature.org. You can check, you can click and on the House and Senate calendars every day, and they list a full week's worth of hearings every day, but it's updated every single day because committees may change their mind about what they're going to work on tomorrow, for example. Well, not tomorrow, because tomorrow's Saturday, but they may change their mind and add a bill or take a bill off. So it's worth checking every single day. But that's the best possible place to find out what's happening every day. And if there's something that you're interested in that you know we're working on, you can always get a hold of Christy and me too, and just say, hey, I've lost track of where House Bill 3470 is. Could you let me know? I'm making that up. There is no House Bill 3470.
Yeah, and I'll also add that each committee also posts their agendas for the week. If you go to the Kansas Legislature website and click on committees, like if you want to see what's happening in House Health, they'll have their agenda posted most likely, so you can check there as well.
Thanks.
Great question, though. Thank you. Do we have any other ones before we hop off for today? All right. Well, thank you all for joining. Our next call is scheduled for March 8th, and we have a board meeting for Oral Health Kansas that day. So I'm planning on doing maybe just like a video update so that I can still keep you guys up to date on what's happening. And feel free, if you have any questions, to always shoot me an email or give me a call. Thank you guys for joining today. Have a great day.
Have a good weekend.
Thanks.